After many weeks of fairly low positive test results, public health officials in New Hampshire are noting a slight uptick in COVID-19 infections over the last week.
As mentioned in the last week, I think our numbers have increased a small amount, and we're obviously watching this very closely. But it is important to note that the percentage of all PCR-based tests that are positive still remains low. Stably low in New Hampshire at around 1%, 1.5% of all PCR-based tests are positive for COVID-19.
Governor Chris Sununu says the state is doing a deep dive into what's driving the increase and the fluctuating numbers of positive test results.
The numbers are kind of going up and down and up and down, and we're looking at exactly why that is. We're still fairly consistent with around 30, average of about 30 cases a day. Our percent positive is remaining fairly steady, of course. But I just want to remind folks not to get too excited about low numbers and too dire about higher numbers.
While contact tracing on these latest cases is ongoing, Dr. Benjamin Chan says the most common form of transmission of the virus here is between people who know each other.
I am not aware of any other than the occasional facility outbreak, like long-term care facility outbreaks. I'm not aware of any other large groups or large gatherings that have led to outbreaks.
Today, we also had the opportunity to speak with Vice President Mike Pence. We asked him about back-to-school safety, testing turnaround times, and also the possibility of a vaccine potentially as early as later this year. In an interview recorded by the Office of the Vice President, the VP told us that one of the ways the administration is trying to speed up the process of getting to the end game of this pandemic is to produce vaccine doses before the clinical trials are finished. So if the vaccine is eventually approved by the FDA, they will have those doses ready and waiting to distribute nationwide.
And what the people of New Hampshire deserve to know is that at President Trump's direction, we're actually not waiting until the end of the clinical trial process to produce the vaccines. We're working with Moderna and other companies to go ahead right now and literally produce millions of doses of their vaccine. So if and when it is approved as it's safe and effective, then we will have tens of millions of doses available to distribute to the American people.
As that work continues, back here in New Hampshire, a new investigation is underway into what has caused and what has driven some of the more aggressive outbreaks of COVID-19 in long-term care facilities in New Hampshire. For more on that new investigation, let's go live now to Charisse Leclerc.